Hello everyone, I am Dr. Queen Aditya, Senior Consultant Gynaecologist at Papilio Clinic, Kolkata. The time of the pregnancy between 29 to 40 weeks is called the third trimester. This is the phase during which the growth of the baby is the maximum, because at around 28 weeks the rough weight of the baby is around 1 kilo, and by the time of delivery it comes to around 3 kilos. So we can make out that there is a huge growth happening in the body of the baby. So now usually we call the patient for frequent follow-ups to ensure that the growth is adequate. We can make out by seeing examining the abdomen, and also we hear the baby's heartbeat to ensure that the baby is doing fine. Certain tests are repeated as and when required, and the blood pressure and weight, which are checked earlier, are also checked every follow-up, and medications are also revised, continued as and when necessary. And at around 32 to 34 weeks, if all is going well, we go for a repeat growth scan, that is an ultrasound, to see that the baby's growth is okay, that the fluid, that is the fluid in which the baby is roaming around in the uterine cavity, that the fluid amount is adequate, and that the growth parameters are absolutely fine as per the gestational age. If we find any problem in any of the above, then we also advise a Doppler study to see whether the blood flow to the baby is adequate. If all is fine, then we call the patient for subsequent regular visits. And then we also advise the patient the exercises which were already started, and we ensure that the same are followed, and yoga and certain other exercises will help them to be mentally and physically prepared for the childbirth. Now, childbirth we try to avoid before 36 weeks, because at 37 weeks we call it a term pregnancy, and we try to carry any pregnancy beyond that. And if there is labor pain or any other problem before 37 weeks, we try to pull it along at least beyond 37 weeks to ensure the well-being of the baby. And roughly around 37 to 38 weeks, we call the mother for an internal examination along with other examinations to see whether she is fit for a normal delivery or how soon or she might go into labor. All of this is provided that everything is going uncomplicated. If there is any complication detected earlier, then we have to take steps likewise. And as far as the mother is concerned, she is asked to eat properly, medications as well, as long with proper nutrition, adequate fluid intake, and she should be happy. She should generally keep herself happy to be prepared for the upcoming childbirth. And the mode of childbirth will be decided later according to the situation of the mother.